Some of the challenges that I faced during rehab, I think I'll go back to early stages after surgery. I had a lot of edema the first week following surgery. I had a lot of hamstring pain, not consistent, but anytime my leg would move unexpectedly, my surgical leg would move unexpectedly, or stretching in bed, I would have some searing pain at the site of my hamstring harvest. Also felt a lot of frustration early on with my inability to get my VMO to fire. Something I would be able to do the day before, I wouldn't be able to do the next day. And I found that incredibly frustrating. Also getting knee flexion back, those first couple of weeks, I found that to be fairly painful when I was working on it. I know it's really important to get both flexion and extension back. It took some work. I really saw big gains in the first week following surgery as far as, feeling better. I don't even know how to describe it, but I felt like things were really improving rapidly. And then I found that recovery curve really leveled off about a week after surgery. And as a result, a result of that, but also I think the whole process of going for surgery, going through the insult of surgery, and all sorts of other things, started to experience symptoms of depression following my surgery. So definitely feeling incredibly low, found myself crying, found myself not wanting to get out of bed. And my normal mental health coping tools include exercise, spending time in nature, being active with friends. And so because of the surgery and my recovery, I really couldn't access these tools. So when I started to feel low, I really didn't know what to do about it, aside from, talking to friends and family about it. I didn't have other tools in my toolbox. Later on in my recovery, I was riding my bike. I had been cleared to ride my bike on flat surfaces. And twice I had a bike crash. I haven't crashed my bike probably since I was a kid. And both times I landed on my operative side. So I had a lot of fear about if I damaged my knee or not. And, that fear carried over to when I started to do things, later in my recovery, like getting on skates for my first time. Definitely felt some fear about injuring myself as I was sliding on surfaces. The first time I got back on skis, definitely have fear of re-injury, and, even other things like winter driving, which, usually I'm pretty careful driver, but I had more kind of global fear in my life during the recovery process, which is not surprising when you think about it, but again, I wasn't necessarily expecting that. So another challenge I would add to the mix is the time involved in doing rehab early on in the recovery, or maybe even in the first, 3 to 4 months when I was really working on getting my extension back. There were a lot of days I was spending 2 hours doing physio, and that's a lot of time if you have other demands on your time. So that was something that was challenging. Some of the strategies I used to overcome some of the challenges I shared from a mental health perspective, I started doing some research or digging around into the research about mental health and ACL reconstruction, and that really helped to normalize what I was feeling from a mental health perspective. Looking at some of the literature, found that patients who sustain an ACL injury can suffer from symptoms of depression, and I definitely felt that after my injury. But also in the 6 weeks following reconstruction. So again, knowing that was really helpful. So if it's helpful to anyone listening, you're not alone in feeling those things. Another study I looked at found that 40% of people who undergo ACL reconstruction experience clinically diagnosable depression. So again, knowing that that was something other people experienced was really helpful for me. I also found getting off social media during my recovery process was something that really helped me, because I found it quite hard to see photos, videos of people doing the things that I love to do, and people I love to be with, and not to be there with them. I also cut out alcohol because I found that I didn't, alcohol being a depressant, I didn't need any help feeling sad or sorry for myself. And so that was, and obviously lots of other health benefits to doing that. Building a recovery community. So I mentioned I had friends who had also gone through surgeries recently who are helpful, but also friends and family in your life who can support you. I found that some people are better able to support you than others. So really making an effort to connect with those people, and enabling them to help you any way that they can. I think it's also was helpful for me to find a physiotherapist who was a good fit for me. I worked with a couple different physios throughout my recovery, and the one I ended up going through the whole duration of my recovery was a really great fit for me, and she was willing to answer my questions over email between visits. So she was able to give me a lot of support. If I was feeling, I was concerned about something, she was able to answer my question fairly quickly. So just giving me that peace of mind was really, really quite helpful. On the physio, continuing on the physio front, I had a dedicated space in my apartment where I would do my physio. So I set up my road bike on a trainer, had all of my equipment there, Bosu ball, whatever other exercise equipment you have. And it sounds cheesy, but I put up some inspirational, excuse me, quotes on the wall. And if any of you are Ted Lasso fans, I had a big Believe banner over my bike, and some other quotes. I think one was had to do with Will Smith. He talked about, how do you build a wall? You build it brick by brick. And so that was my approach to physio, is that every day I'm going in, I'm not making huge gains, but I'm laying down a brick on the wall, and the wall of my recovery, and getting back to my activities, and spending time doing those activities. Something else I found was really helpful from a physio front, once I got further along my recovery, was going somewhere else to do physio. So going to a friend's gym while they're working out, I would do my physio, or going to my community gym, and being surrounded by other people who are active was something that I found to be pretty helpful. And during the summer, getting outside to do physio, that was something I really enjoyed. Again, it's just nice to be spending time outside. I use some different ways to track my physio and try to stay motivated. I built a big spreadsheet. I'm trying to think what else I did. I had almost like a weightlifting journal where I'd include how many reps I was doing each day. And in the end, I ended up using a really simple physical calendar. And so it was helpful for me to track my progress and keep myself accountable. If there are any road cyclists listening, I really enjoyed using the cycling game Zwift. It was quite fun because you could also socialize, ride along with friends in other places, and give you something else to focus on, or actually have fun with while you're getting riding your bike during your recovery. I found it really hard over the course of recovery to back out of a number of trips that I was really looking forward to, both ski trips and river trips. So I endeavored to focus my energy and my attention on using that vacation time to visit with friends and family who I normally don't get a chance to see when I'm spending my time skiing or on the water. And I guess the other thing I did was really allow myself to indulge in some watching some television. It's not something I do a lot of typically, but got caught up on a lot of shows, and also really got back into reading. I read 52 books last year. So that's something I really turned to for an escape and to help fill some time. And, finally, once I was cleared to do it, I really enjoyed getting back into stretching, yoga, just being able to move your body in ways that, or move my body in ways that I had before. That felt really good. As far as things that were easy during rehab, I got really lucky and didn't experience a lot of, global pain after my surgery, or, like I was saying earlier, I had hamstring pain, but that was intermittent. It wasn't consistent. Was really diligent about elevating and using the cryo machine in the first week to 10 days. And I think that really helped. Something else that was easy and could be helpful for others is connecting with other people in your life, or maybe even people at a distance. You could be following them perhaps through social media who are also going through recovery. I had a group of friends who went through surgeries around the same time. One friend had a double knee replacement, another friend had a hip replacement, another friend had a different kind of major surgery. So although we had different surgeries, we could understand what it was like to have recently had a surgery and to have your life change dramatically. And so even messaging with them, I found, was really helpful. And, later on in the process too, because it is a longer recovery process, I found I continued to lean on those people. And another thing I found fairly easy in a way is being quite diligent with doing physiotherapy. And my main motivator was I never wanted to have to go through this again. I wanted to heal really well, or as best as I could. So that's something I found was fairly easy to do.